I was married in June, and a few months later learned that I was going to have a baby. About 5 weeks into the pregnancy, I started spotting. Being a novice at this, I was very frightened. I called the doctor immediately. He said, "You are very fortunate. We now have a drug that will help you keep this baby." Kathleen was my fourth born child. I had suffered through 2 very unpleasant miscarriages before she was conceived. She is a medically proven case of the effects of DES.
So I ended up going in for exploratory surgery, and they weren't sure what they were going to find, but they in fact found that I had been 8 weeks pregnant, and it was so, twisted and everything that they had to remove the tube. I got pregnant for a 3rd time, and everything was going smooth. There didn't seem to be any problems. I was having no bleeding, so I thought, "No, this is amazing. Maybe, in fact, with that little centimeter of a tube I had left, something worked." And in fact, it was yet another ectopic, because the sonogram they did on me was ectopic.
In 1938, Sir Charles Dodd synthesized a synthetic hormone which was very, very inexpensive. That was diethylstilbestrol. At that time, miscarriage was not well understood, and the theory arose that if one used diethylstilbestrol, it stimulated some of the cells in the placenta to produce progesterone and therefore would prevent miscarriages.
DES became a kind of a wonder drug during the baby boom era, and it's estimated that between 1938 and 1971 it was prescribed to about 4.8 million pregnant American women. It was also used widely throughout Canada and Australia and Europe.
It was something that was originally given with the best intentions and the best wishes, and seemed to be something that might answer the wishes for everybody, the wishes of the mother to have a baby, the wishes of the doctor to be able to be helpful to the patient who was the mother and make her a baby.
And it wasn't until 1971 when Arthur Herbst of the Massachusetts General Hospital and Howard Elfelder noted the sudden appearance of a tumor, clear cell adenocarcinoma of the cervix and vagina in young women, and in their investigation of these tumors, recognition that the offending agent was the taking of diethylstilbestrol in the first 21, 24 weeks of gestation.
Well, there's no question about the fact that the presence of the malignancy, even though it has been in a very, very small number of the women, is an absolutely devastating and tragic outcome of the use of this medication. The other problems are, in essence, many of the same problems that the drug was produced to prevent.
Many people think DES is an old issue. It's been around for years. What's new? Why should we be concerned about it? We should be concerned for many reasons. The DS-exposed population, in other words, DS mothers, daughters, and sons, all have unique problems. For instance, the DS mother, she has a slight increased risk of breast cancer. The DS son, we know there's an increase in epididymal cysts, sometimes some deformities of the genitals, such as smaller testicles. In the daughters, they have both structural changes of the way their cervix and vagina is shaped. There's tissue changes. They have all kinds of problems with pregnancies, such as miscarriages, tubal pregnancies, premature deliveries. DS is linked to a very rare form of vaginal cancer called clear cell adenocarcinoma. The incidence is about 1 in 1,000.
It was 1991, and I went in for a regular checkup. He told me it was fine. Then about a month later, I went back and said, "No, this just isn't right." And he said, "Well, I see some kind of ulcer." And the next morning they pretty much took this whole, quote, ulcer out. I distinctly remember the conversation. I said, "Well," and he said, "It's clear cell." They scheduled me for surgery 9 days later.
I think that there is a misconception conception that everybody who's DES exposed knows about it by now, and they know what it means in terms of the possible adverse effects in their life.
Any person born between 1938 and 1971 should try and find out if their mother took DES. They can do that by asking their mother, or perhaps their father, aunt, the doctor who delivered them. The questions to ask her: did mom take any medications when she was pregnant? Did mom have any bleeding problems? Did she have a prior miscarriage? Maybe she had diabetes or high blood pressure when she was pregnant. Perhaps she'd had a prior stillbirth. Maybe she had an infertility problem. Did she have any kind of problems that the doctor may have been concerned about and would have given her a medication for? If there's any indication that your mother took any kind of medication, or if the doctor that you are seeing now has seen any evidence of DES exposure, consider yourself a DES exposed person.
My advice to any mother who took DES, and they know they did and they have children, is to tell them. I would have been going to a specialist a lot sooner had I known, or it would have been a question. I would have at least called my gynecologist and said, listen, I just found out this information. What do you think?
For the DES daughter, there's a sense of what is going to happen, what is wrong with my body now, what might be wrong, what's going to happen.
Healthcare providers and their patients are just finding the language to talk about DES. For instance, there are many ways that a DES patient can better communicate with her physician.
I don't go in with questions, and I know I should, but at the same time, I have almost a sense of fear of finding out. I'm in the stage where I haven't tried to have children as of yet. I'm almost afraid to go in what they're going to say to me right now. I don't know whether I'm emotionally ready for that.
I used to feel exactly the same way that you were talking about. It's very scary to go in for a doctor's appointment and not know what you were going to hear from the physician. But as time has gone on, I have found that the more information I have, the better I feel, the more in the driver's seat that I feel about my health care. Asking the questions won't affect the state of my health, but it will affect the amount of information I have to be able to work with my physician to make good decisions about my health care.
I've advised a lot of DES-exposed people, particularly if they're going through a rough time, to take notes. And if they really feel that they can't even take notes, to bring another set of ears. Even if you wanted to bring a tape recorder to tape it, of course, with the doctor's permission, to ask if you could do that. Because a lot of times what seems to happen is the patient kind of has office visit amnesia.
One thing I think we have to do as consumers is, if we're finding a new doctor, is ask about that doctor's knowledge of DES too. Don't just go to any doctor. You want somebody who specializes or sees a lot of DES patients, and someone who's going to be up on it and be reading about it and know the latest things going on.
I have the same situation. I go in, I have, a list of questions that I want to go over. And I actually saw a book on my doctor's shelf that I was interested in. It was Infertility. And he said, definitely you can take it and borrow it, and return it in your next visit.
DES daughters may have a slightly increased risk for infertility. Most studies show that the majority of DES daughters can become pregnant and deliver healthy babies. DES daughters concerned about their fertility should consult their health care provider. Concerns have been raised about fertility problems among sons exposed to DES. A recent New England Journal of Medicine article found no significant relationship between DES and infertility. DES sons concerned about their fertility should consult their health care provider.
For me, the value of this group has been to have a better understanding of the issues and help me be more sure when I visit my doctor of the things I need to look for and the things I need to say, and to know that it's my right to do so.
I tell DS daughters that they're very special. They're a special group of women with their own particular type of potential healthcare problems. All DS daughters should tell their doctor that they're DS exposed or that they suspect that they're DS exposed, and ask the doctor, what kind of health care are you going to give me? Try and protect your health by making sure he gives you the right answers. Arm yourself with the right answers. Find out about the annual pelvic exam. It's different than it is for a non-DES exposed woman.
This seems like a good time to go over what a thorough DES exam should consist of. If you're a DES daughter, the doctor should do a thorough palpation of the entire vagina. The doctor's actually feeling for anything that seems unusual or irregular. And then the doctor will do a pap smear from the cervix as he would for anyone. But if you're DES exposed, the doctor should also be doing a vaginal pap smear from the top part of the vagina. And in order to do that, the doctor has to rotate the speculum, because if you think of the positioning of the speculum, it's covering that anterior vaginal portion. Obviously, you'll have a regular internal, as would be done with anyone, keeping in mind that that portion of the exam is to feel, if possible, the ovaries and the uterus and the fallopian tubes, it has nothing to do with feeling the vagina, so that it's two distinct steps.
For DS daughters who are pregnant, it's important to see your healthcare provider as soon as you've missed a period. Get that pregnancy test done. When you're about 6 to 7, 8 weeks pregnant, get a sonogram so that we can determine whether that pregnancy is actually in the tube or is it in the uterus. If it's in the tube, that's not a viable pregnancy. It means that it's a potentially life-threatening situation. You need care immediately. DS sons should try and find out if their mothers took DES. They should let their healthcare provider know, particularly their urologist. The men should practice self-testicular exam once a month. The DS mother, the woman who took the drug, we know that she has a slight increase in breast cancer. So it's very important that she practice monthly self-breast exam. It's important that she have her mammographies on a regularly scheduled basis, and that she get a breast exam from a healthcare professional once a year.
I do think that most DES patients are not looking for blanket reassurance. They are looking to have their concerns taken seriously. They're looking for help in understanding what this means in terms of their overall life.
It wasn't until I went to a DES action meeting that I really realized the implications of DES exposure. When you're sitting there with 20 or 30 other women who have been in the same situation as you, who have they were telling their war story, so to speak, and then you start to say, well, this is something that is a little more serious.
The Cancer Network has done a wonderful job of helping us develop a community of people who've experienced the same thing. And the network has given us a place to talk about that and not have anyone say, well, you're lucky to be alive.
I think it's important that we keep in mind that the drug that we gave, that was given so many years ago, is today's problem. For more information about DES, call 1-800-DES-NEWS.